Vaccinations Lecture. Vaccines prevent disease from spreading from person to person. If one person gets a disease, it is spreadable to other people who come in contact. Vaccines help eliminate serious illnesses, diseases in a population. Oftentimes you will hear the term referred to as herd immunity in the news. Herd immunity is when the people who are eligible to be vaccinated are, and those who are immunocompromised and cannot be vaccinated are protected because all the other people around them are immune and unable to contract the disease. So the likelihood of them contracting the disease who have not been vaccinated is low. However, the problem lies within our population that if everybody relies on herd immunity and nobody gets vaccinated, then the likelihood of diseases become more prevalent in our communities. Patient education is very important. Every patient should be given a VIS sheet or vaccine information sheet for each immunization. We are required to give this to each patient. It educates our patient on what we are immunizing them for, what to do if there's bad reactions. What if a parent does not believe in vaccinations? We are to explain as medical assistants and healthcare professionals that the autism study that was done several years ago that linked autism and vaccinations was falsified by the scientists, so it was not a valid study. Herd immunity is not 100% effective, and explain the importance and theory behind immunizations. In Africa versus the United States, Africa, polio is still very prevalent, whereas in the United States, we don't see polio at all. And this is due to our high immunization rate. Rules for administration. The person who draws up the vaccine is the person who gives the vaccine. A person who gives the vaccination documents it once it's given. Vaccines should only be drawn up at the time of administration. If a vaccination is drawn but not given, it should be thrown away. It should not be saved for the next patient. And who should not receive a vaccination? Those who are immunocompromised, those who are sick at the moment, running a fever, cancer patients, and some people who are pregnant. Some vaccinations are not recommended. Vaccine doses, so there are pre-filled vials, or they are also called cartridges, multi-dose vials, which have more than one dose in them, always should be labeled with the date it is opened and initialed by the person who opened it. They are only good for 28 days after the date it was opened. Reconstituted vials should be labeled with the date and time of reconstitution. Expired vaccinations. Expired vaccinations and diluents should not be used. They should also be pulled from the shelf immediately. Also to consider, those vaccinations without a label or a damaged label should be thrown out immediately. Vaccine reactions. There are a wide range of vaccinations. Anaphylaxis usually results in the loss of consciousness. Localized reactions such as rash, which is also called urticaria, redness, also called erythema, soreness, itching, also called pruritus, and minor swelling. We also use the term edema when describing these. When a patient calls in with a reaction, or a patient comes in with a reaction, it's important that we describe these types of things when describing that rash and documenting that appropriately.